Welcome, and thank you for joining us today for a presentation on the new CMS-1500 and the expanded provider law, specifically how they relate to billing for providers. The main focus of today's webinar is to answer some of the most frequently asked questions we have received from providers regarding both initiatives. Resources will be provided at the end for additional questions. Today's presentation will start with a brief overview of the Centers for Medicare and Medicaid Services Form CMS-1500. As CMS-1500 is already familiar to virtually all medical providers and insurance carriers, the board anticipates a relatively smooth transition to CMS-1500. The initiative will leverage providers' current medical billing software and medical records while promoting a more efficient workers' compensation system. After the overview, we'll then take a look at the top questions we receive about CMS 1500. Next will be an overview of the expanded provider law and what providers need to know. Please note, this presentation will provide information and answer questions regarding the billing and technical side of CMS 1500. If you have practice or clinical-related questions that are medical in nature, you will be provided with resources at the end of the presentation. The CMS 1500 and expanded provider initiatives are part of a larger effort to increase injured workers' access to high-quality health care. Both are aimed at getting more healthcare providers to participate in the workers' compensation system. Having more providers who treat injured workers in New York State gives injured workers more and better options for getting the care they need, so they can recover and return to work. So now let's take a closer look at each initiative and some recent frequently asked questions. We'll start with our transition to the Universal Billing Form, the Centers for Medicare and Medicaid Services, CMS 1500. Providers have previously indicated that the unique paperwork requirements currently in the New York State workers' compensation system are time-consuming and cumbersome to complete. To reduce the administrative burden on providers and encourage participation, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS 1500 form. Healthcare providers are very familiar with this form as they already use it to bill the Centers for Medicare and Medicaid Services, CMS, as well as health insurers. Moving to the CMS 1500 billing form will remove a barrier for healthcare providers to participate in the workers' compensation system. And ultimately, it'll give injured workers more options for treatment. Now, let's answer some of the most frequently asked questions from providers about the board's transition to the CMS 1500. Question 1. How will the CMS 1500 be phased in? Well, CMS 1500 will be rolled out in 3 phases. Phase 1 is voluntary submission, which is the phase we're currently in. During this phase, providers may voluntarily transmit CMS 1500 medical bills and required medical narratives and/or attachments as applicable through their XML submission partners, most commonly known as clearinghouses, to workers' compensation payers, which includes insurers, third-party administrators, or self-insured employers. To participate in the initiative, providers must register with the board to submit the CMS 1500 via an XML format. The XML Forms Submission Project, XFS, was created to set up a method to allow the submission of data to the Workers' Compensation Board in an industry-standard format, XML, Extensible Markup Language. Clearinghouse status can be found by visiting wcb.ny.gov and typing List of XML Submission Partners into the search box located at the top left-hand side of the page. Phase 2, Explanation of Benefits Transmittal, 2021. Phase 2 will require payers to use specific Claims Adjustment Reason Codes, otherwise known as CARC, on their provider EOBs when objecting to payment of a medical bill. You can review these CARC codes by visiting our website at wcb.ny.gov and searching for CARC codes. Phase 3, Mandatory Submission, 2021. Phase 3 will most likely run current to Phase 2. Providers will be required to submit electronic CMS 1500 medical bills and required medical narratives, as applicable, through their clearinghouses to workers' compensation payers and to receive EOBs back through their clearinghouse. The XML submission process will be the same as described in Phases 1 and 2. Question 2. Can providers use and submit a CMS-1500 now? Yes. Providers may currently submit the CMS-1500 via mail, email, web upload, and XML. However, it is recommended that it is done electronically through one of the approved XML submission partners. A paper or emailed CMS-1500 may only be submitted until it becomes mandatory to submit by XML. The board anticipates a mandatory implementation date of July 2021. The board strongly encourages providers to switch to using the CMS 1500 now in order to become familiar with it prior to the mandatory July 2021 implementation date. Question 3. Where can I find instructions on how to fill out the CMS 1500? There are a number of resources on the board's website regarding the CMS 1500. PDF examples of the CMS 1500 by provider type can be found by visiting wcb.ny.gov and searching CMS 1500 examples. On that same page, there are also sample forms showing how information from the Doctor's Initial Report, Form C4, Doctor's Progress Report, Form C4.2, Ancillary Medical Report, Form C4AMR, Attending Ophthalmologist's Report, Form C5, Doctor's Narrative Report, Form EC4NARR, Psychologist's Report, Form PS4, and Occupational Physical Therapist's Report, Form OT-PT4, transfer to the CMS 1500. Question 4. Where is the treating provider's information entered? The authorized provider who rendered the services should include their National Provider Identifier, NPI, in field 24J of the CMS 1500, and they are required to electronically sign the CMS 1500 in field 31. Additionally, their WCB authorization number should be found in field 19 along with their rating code. Note, the treating provider should electronically sign the bill, even if it is one of the newer provider types authorized through the expanded provider law, which we'll discuss shortly. Question 5. Can all providers submit the CMS 1500? All board-authorized providers are able to submit the CMS 1500. A new law, the Expanded Provider Law, was recently passed expanding the types of medical providers that can be authorized to treat injured workers in the New York State Workers' Compensation System. Prior to this law taking effect, only physicians, chiropractors, podiatrists, and psychologists were able to be authorized to treat injured workers. As of January 1, 2020, licensed clinical social workers, nurse practitioners, and acupuncturists, as well as physician assistants, occupational therapists, and physical therapists, may apply to become board-authorized providers. We'll share more on the expanded provider law a little later in the presentation. Question 6. What other forms can I use now? All medical providers are encouraged to use the CMS 1500 form with an attached medical narrative report, but the current forms may continue to be used until the electronic submission of the CMS 1500 becomes mandatory in July 2021. Note, currently, acupuncturists may only submit a paper CMS 1500. When acupuncturists are able to register for CMS 1500 XML, it will be announced through WCB notifications. Acupuncturists are encouraged to sign up for WCB notifications, if they have not done so already, to receive this notification. Visit wcb.ny.gov and select Get WCB Notifications on the bottom of the homepage to sign up. You can view this chart by visiting wcb.ny.gov and searching Board Forms by Provider Type. Question 7. Where can I find specialty rating classification codes for treating providers? Physician and non-physician specialty rating classification codes can be found by visiting wcb.ny.gov and searching Rating Classification Codes. As previously noted, the treating provider's rating code should be found in field 19 of the CMS 1500. Question 8. Will there be a regulation change when the electronic submission of the CMS 1500 becomes mandatory? The regulations were published on June 10, 2020. As part of the CMS 1500 XML submission, payers will be required to acknowledge receipt of the bill back to the XML submission partner. Question 9. Will the required timeframes for submitting the medical reports change as a result of this initiative? The timeframes for submitting medical reports to the board and the payer, set forth in New York Codes, Rules, and Regulations, Section 325-1.3, are not changing as a result of this initiative. The following timeframes are still required. Initial CMS 1500, formerly the C4, OTPT4, or the PS4, should be submitted within 48 hours of first treatment. Subsequent CMS 1500, formerly the C4.2, OTPT4, or the PS4, should be submitted 15 days after the first treatment, and thereafter for continuing treatment, after each follow-up visit scheduled when medically necessary, but not more than 90 days apart. As you may know, the board amended Regulation Section 325-1.25 effective January 1, 2020. This change simplifies the billing dispute process by eliminating the continuous course of treatment concept and extends the time frame for bill submission to 120 days after treatment. Question 10. Do all CMS 1500 submissions require a narrative or attachment? Yes. All CMS 1500 submissions, whether submitted through an XML submission partner or sent directly to the board, require a medical narrative and/or attachment. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies provider submissions of the CMS 1500. A PDF of a medical narrative report template can be found by visiting wcb.ny.gov and searching for Medical Report Template. Question 11. Is the doctor's report of MMI permanent impairment, Form C4.3, being replaced with the CMS 1500? No. The doctor's report of MMI permanent impairment, Form C4.3, will not be replaced when the CMS 1500 form becomes mandatory. Question 12. Will the board require a standard set of codes for payers to use when objecting to a bill? Yes. The board has published a standard set of claims adjustment reason codes. It's expected that these codes will be required to be used on explanation of benefits sent to the provider effective July 1, 2021, if a payer objects to a medical bill. There is one set of codes that all payers must use, instead of each payer having their own code, so this should make it easier for providers to know why a submitted medical bill was not paid in full. Now that we've walked through the most frequently asked questions we have received from providers on the CMS 1500, let's look at another initiative, the Expanded Provider Law, and what you as providers need to know. The Expanded Provider Law went into effect in New York State as of January 1, 2020. This law expanded the types of medical providers that can be authorized to treat injured workers in the New York State Workers' Compensation System. As of January 1, 2020, licensed clinical social workers, acupuncturists, nurse practitioners, physician assistants, occupational therapists, and physical therapists may apply to become board-authorized providers. This change has already brought thousands of newly authorized providers into the workers' compensation system, and it's expected that number will continue to grow dramatically, improving injured workers' access to health care. Ancillary providers who currently treat must become authorized or have an authorization application pending with the board to continue treating after January 1, 2020. Here are some of the top questions we've received from providers in regards to the Expanded Provider Law. Question 1. Who can do what? Under the Expanded Provider Law, certain types of medical providers can be authorized for certain services. Let's take a look at what each profession can and cannot do in the workers' compensation system. Board-authorized acupuncturists are able to treat workers' compensation patients, but will require a referral from the treating healthcare provider. Board-authorized acupuncturists do not have the ability to perform independent medical examinations, or IMEs, which are consultations performed to help resolve disputes in workers' compensation cases, usually at the request of the insurer. Board-authorized licensed clinical social workers are able to diagnose and treat clients who have work-related injuries or conditions, provide opinions on causal relationship, whether injury or illness is causally related to work, make determinations for a client's initial and ongoing level of disability, and provide opinions on permanency, the degree to which a client's disability is permanent. Board-authorized licensed clinical social workers do not have the ability to perform IMEs. Board-authorized nurse practitioners are able to diagnose and treat clients who have work-related injuries or conditions, provide opinions on causal relationship, whether injury or illness is causally related to work, make determinations for a client's initial and ongoing level of disability, and provide opinions on permanency, the degree to which a client's disability is permanent. Board-authorized nurse practitioners do not have the ability to perform IMEs. Board-authorized physician assistants are able to treat workers' compensation patients under the treating provider's supervision and to determine a patient's ongoing level of disability. Board-authorized physician assistants do not have the ability to perform IMEs. Board-authorized physical therapists will be able to treat workers' compensation patients, but will require a referral from the treating medical provider. Also, while physical therapists are currently able to treat injured workers, those who are employed by a medical practice, as well as those who are self-employed, may now obtain their own authorization. This means they will be listed under their own name in our registry of authorized providers. Board-authorized physical therapists do not have the ability to perform IMEs. Board-authorized occupational therapists will be able to treat workers' compensation patients, but will require a referral from the treating medical provider. Also, while occupational therapists are currently able to treat injured workers, those who are employed by a medical practice, as well as those who are self-employed, may now obtain their own authorization, meaning they'll be listed under their own name in our registry of authorized providers. Board-authorized occupational therapists do not have the ability to perform IMEs. All of the information just shared is also available in chart form on the board's website at wcb.ny.gov/new-provider. Select Changes for Authorized Providers, Who Can Do What chart in the Related Resources section. In addition to the new provider types, the chart also covers what physicians, chiropractors, podiatrists, and psychologists can be authorized to do. Question 2. How do I become authorized to treat injured workers or to perform independent medical exams, IMEs? To apply for authorization, you must sign up to use the New York State Workers' Compensation Board medical portal and/or log in with the credentials that have been assigned to you, complete the required training specific to your profession, and complete the New Provider Authorization Request online application. As a reminder, only physicians, chiropractors, psychologists, and podiatrists may enroll to perform IMEs. Question 3. How often do I have to renew my authorization? Your authorization runs concurrent with your state license. Whenever you need to renew your state license, you should also renew your authorization. When your license expires, you will receive an email from the board with instructions on how to renew your authorization. This renewal will all be done online via the board's medical portal. Question 4. How can I check authorization status? The board has an online search of all healthcare providers and independent medical examiners who are authorized with the Workers' Compensation Board. Visit wcb.ny.gov/healthcare provider search and scroll to the bottom of the page. You can search for either healthcare providers or IMEs. For a full list, use the Find All tab and view download results in Excel. To inquire about provider application status, email provider@wcb.ny.gov. You can also stay informed of changes to the authorized provider list by subscribing for WCB updates. Visit wcb.ny.gov and select Get WCB Notifications on the bottom of the homepage. Question 5. Which medical fee schedule should I be using? This table details the medical fee schedule each new provider type must use. It's important to note that while there are some revisions to the New York State Workers' Compensation Board medical fee schedule effective January 1st, 2020, there were no CPT coding changes made. With the exception of the New York State Workers' Compensation Acupuncture and Physical and Occupational Therapy fee schedule, which must be purchased from Optum 360, all other revisions to the fee schedule are available as free downloads from Optum 360. Please note that per Acupuncture Ground Rule 7, an acupuncturist may only use CPT codes contained in the acupuncture fee schedule for billing and treatment. A licensed acupuncturist may not use codes that do not appear in the acupuncture fee schedule. For more information on medical fee schedules, visit wcb.ny.gov and type in medical fee schedules into the search box in the top left-hand corner. Question 6. What other providers or medical suppliers can perform services? The following provider types and entities can also provide services and submit HP1s for unpaid bills: ambulance services, ambulatory surgery centers, audiologists, dentists, durable medical equipment vendors, hospitals, laboratories, optometrists, out-of-state providers, and pharmacies. Question 7. What if my bill isn't paid? Providers authorized by the board will be able to use the Request for Decision on Unpaid Medical Bills, Form HP1 process, if their bill is disputed or not paid. HP1 must be submitted under the provider name and authorization number. It cannot be submitted using the practice name. Billing information and training is available on the board's website under Healthcare Information. Note, this process will be moving online in early 2021 as the board begins a phased rollout of a new business information system. There are a number of additional resources available to you on the CMS 1500 and expanded provider law initiatives. For more information on the CMS 1500 initiative, you can visit wcb.ny.gov/CMS1500 and email cms1500@wcb.ny.gov. For more information on the expanded provider law, you can visit wcb.ny.gov/new-provider and email provider@wcb.ny.gov. To stay informed on these and other initiatives designed to make the board better for workers and better for business, you can subscribe to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You choose the topics you'd like to subscribe to. You can also follow the board on Twitter, YouTube, Facebook, and Instagram for board news, project updates, training, and more. Thank you for watching this presentation on the new CMS 1500 and the expanded provider law, specifically how they relate to billing for providers. Please contact us if you have any questions on these or other New York State Workers' Compensation Board initiatives. Thanks again.